We keep hearing following the science. What is science essentially? It's the study of the natural world through experiment, through observation. So that's what we're doing. We're studying the disease around us. We're making observations. We're doing testing, experiments to figure out exactly what's going on. When I talk to ER physicians around the country, what's happening? Well, because COVID has become the focus, people with heart disease, people with cancer, hypertension, and various things that are critical are choosing not to come in based on fear. So what that's doing is causing the health system to focus on COVID and not focus on a myriad of other things that are critical, because we don't have the staff there, and the major component is fear. People are saying, I don't want to go get seen by my doctor. What if I get the COVID? So there is a lot of secondary effects to COVID that aren't being talked about. We've never seen where we quarantine the healthy, where you take those without disease and without symptoms and lock them in your home. So some of these things, from what we've studied from immunology and microbiology, aren't really meshing with what we know as people of scientific minds that read this stuff every day. So that's kind of how we started. We don't know what's going on. We see this new virus. How should we respond? So we did that initially. And over the last couple months, we've gained a lot of data. So we're seeing millions of cases, small amount of death. Millions of cases, small amount of death. It's similar to the flu. If you study the numbers in 2017 and 2018, we had 50 to 60 million with the flu. And we had a similar death rate. The deaths in the United States were 43,545, similar to the flu of 2017, 2018. We always have between 37 and 60,000 deaths in the United States every single year. No pandemic talk, no shelter in place, no shutting down of businesses, no sending doctors home. The secondary effects. COVID-19 is one aspect of our health sector. What has it caused to have us be involved in social isolation? What has it caused that we are seeing the community respond to? Child molestation is increasing at a severe rate. We could go over multiple cases of children who have been molested due to angry family members who are intoxicated, who are home, who have no paycheck. These things last a lifetime. This isn't about a seasonal flu. These are things that will follow these people and affect them in a negative fashion for their life. And these are secondary effects from COVID. And these are from me talking to ERs, talking to my doctors, and talking to people across the country and finding out what they're seeing. Spousal abuse. We see people coming in here with black eyes and cuts on their face. It's an obvious abuse case. These are things that will affect them for a lifetime, not for a season. Alcoholism, anxiety, depression, suicide. I talked to Donnie Youngblood and various people in the community, and I've asked them, how are things going? Suicide is spiking. Education has dropped off. Economic collapse. Medical industry, we're all suffering. The immune system is built by exposure to antigens, viruses, bacteria. When you're a little child crawling on the ground, putting stuff in your mouth, viruses and bacteria come in, you form an antigen antibody complex, you form IgG, IgM. This is how your immune system is built. You don't take a small child, put them in bubble wrap in a room and say, go have a healthy immune system. This is immunology, microbiology 101. I am telling them sheltering in place decreases your immune system. And then as we all come out of shelter in place with a lower immune system and start trading viruses and bacteria, what do you think is going to happen? Disease is going to spike. It's okay for us to go to Costco, but not to church. Do you see the lack of consistency here? From a microbiological, immunological standpoint, that doesn't make sense. If you're going to isolate people, you need to shut these all down, because that's how the fomites are being transferred. When you go to Del Taco and you get a plastic bag or piece on your burrito from someone not wearing a mask who was just wiping their arm on your thing, do you think you're protected from COVID? When you wear gloves that transfer disease everywhere, those gloves have bacteria all over them. I'm wearing gloves, not helping you. And I say, do we need to still shelter in place? Our answer is emphatically no. Do we need businesses to be shut down? Emphatically no. Do we need to test them and get them back to work? Yes, we do. The secondary effects that we went over the child abuse, alcoholism, loss of revenue, all these are, in our opinion, a significantly more detrimental thing to society than a virus that is proven similar in nature to the seasonal flu we have every year. We also need to put measures in place so economic shutdown like this does not happen again. We want to make sure we understand that quarantining the sick is what we do, not quarantining the healthy. I think we need to open up the schools, start getting kids back to the immune system. And the major events, the sporting events, these are non-essential. Let's get back to those slowly. Let's start with schools. Let's start with Cafe Rio and the pizza place here, because I can go into Sully's right now, which I did this morning. There was 25 people in there, and I can stand in line for 10 minutes, but I can't go in Cafe Rio and sit there for 10 minutes. Does that make sense to you guys? And I can go into Costco and I can shop with people, and there's probably a couple hundred people, but I can't go in Cafe Rio. So big businesses are open, little businesses are not. So from what we're seeing right now, it's time to open back up. The science says it is. The models we have been using from predictions to predict the amount of disease are not accurate. This information is accurate. It models the flu. Let's go back to work. That's what the data is saying. Not models. Data is saying that. And we don't ride subways with 1,000 people in a small car that are this close. They had reasons for the disease. And coronavirus is shown to be very contagious. Let's be clear. It is contagious. We're not saying it's not. It may even be, from what I've read, more contagious and spread more rapid. But the actual cause of death and the disease cycle is similar to what we're seeing from the flu.